Good, how are you?
Good, my name's Natasha, I'm a student nurse. I'll be doing your assessment. Can you just verify your name and date of birth?
Joseph Frida, January 27th, 81.
Okay, perfect. I'm going to go ahead and perform hand hygiene and put on gloves, as well as provide for privacy. Are you having any pain today on a scale of 0 to 10?
0, I'm good
0?
today.
Okay, perfect. So we're going to do the head to toe assessment. Basically means we're assessing you from your top to your bottom.
Okay.
We're going to look at things like your muscle strength, your range of motion, your cranial nerves, some of your reflexes. I'm also going to listen to your heart and lungs and inspect your abdomen as well, okay?
Okay.
If you have any questions at all, let me know.
Okay.
Okay, patient's general appearance is comfortable, well-nourished. He's also well-groomed. Can you tell me your name one more time?
Joseph Frida.
Okay, do you know where you are?
In the hospital.
And who's the president?
Donald Trump.
Okay, so patient is oriented and alert ×3. At this time, your skin, from a general inspection, is good. It has a nice pallor. I don't see any obvious asymmetries. I don't see obvious edema or issues as well. So I would take your vital signs, which is your blood pressure, your heart rate, your respiratory rate, your pulse ox, and your temperature as well. So now we'll start the assessment. I'm going to start at your head. I'm going to palpate your scalp. I'm looking for things like any bumps, any swelling, any bugs, any lesions. I don't see anything. So now I'm going to go ahead and palpate your face if you want to look at me. I'm going to go ahead and feel your sinuses, looking for any swelling or inflammation, and everything feels good. Your face is symmetrical. I don't see any major abnormalities on each side. So we're going to start with your cranial nerves. The first one we're going to do is the olfactory nerve, which is your sense of smell. So I'm going to have you close your eyes and cover up one nostril for me. And go ahead and tell me what this smell is.
Vanilla.
Okay, and do the other side. And tell me what this smell is.
Vanilla.
Okay, perfect. And I'm going to inspect your nostrils. I'm just looking for any polyps or anything of that nature. Everything looks good and it is pink in color. So the next step is going to be your optic nerve. So we're going to do the Rosenbaum test. So it's to test your nearsightedness. We're going to hold this about 14 feet. Here, you can hold it.
Okay.
On your face. And if you can just read this bottom line for me.
Elizabeth said her wish is to be rich, but to have her children live a great life and give back to the community because they're so blessed.
Okay, perfect. So that is correct. So that would be 20/20 vision for nearsightedness. So now we're going to go ahead and do cranial nerves 3, 4, and 6. So that's your ocular motor, your trochlear, and your abducens. So if you just want to go ahead and stare straight ahead, I'm going to test your pupil dilation with the light.
Okay.
Just don't look at the light, okay?
Okay.
Okay, so pupils are equal, round, and reactive to both light and accommodation, and your pupil size is about 3 millimeters, which is normal. If you can go ahead and follow the pin light for me. Okay, so eye movements are equal and lateral on both sides as well. So we're going to move on to cranial nerve 5, which is your trigeminal. Can you go ahead and clench your teeth? All right, we're just going to feel those muscles. The mastoid muscles are good and intact. And then I'm going to go ahead and touch your face with either a soft or a hard object. If you can just tell me where I'm touching and if the object is hard or soft, okay? If you can close your eyes for me. Where am I touching?
Nose.
Hard or soft?
Soft.
Where am I touching?
Head.
Hard or soft?
Soft.
Where am I touching?
Chin.
Hard or soft?
Hard.
Where am I touching?
Cheek.
Hard or soft?
Hard.
Okay, very good. Can you go ahead and shrug your shoulders against my hands? Okay, and that's for cranial nerve 11. So your spinal nerves, accessory nerves are intact. We're going to do cranial nerve 7 for your facial. Can you smile? Frown. Raise your eyebrows. Puff your cheeks. Okay, very good. So cranial nerve 7 is intact as well. Now I'm going to do cranial nerve 8 for your hearing. What I'm going to do is I'm going to place this on top of your head and you just let me know if you can hear the sounds equal on both sides, okay?
Sure.
Are they equal on both sides?
Yes.
Okay. So if they weren't equal on both sides, we do the next step, which would be the Weber test. But because we know that the cranial nerve 8 is intact. So then our final test is going to be our cranial nerves 9, 10, and 11. So the first thing I'm going to do is inspect your oral cavity. So if I'm going to put this on your tongue, if you can just say off for me, okay? Okay, very good. So I'm looking for things like any cavities. I'm looking at your mucous membranes, if there's any swelling on the tonsils, any thrush, anything of that nature. But there isn't, so that's good. So what I'm going to have you do, go ahead and open your mouth. Press your tongue against the blade. Okay, so that's good muscle strength. And now I'm going to test your gag reflex, okay? Okay, very good. And then if you can just stick your tongue out for me and move it left to right. Okay, so muscle movement for the tongue is intact as well. And because the patient has been verbalizing to me, speaking, communicating well, we also know that the vocal cords and the speech nerves are intact. So now we're going to move on to the neck. I'm going to go ahead and palpate your lymph nodes. Okay, and I'm feeling for any swelling, any abnormalities, but everything feels good. So I'm going to go ahead and listen to your carotid artery. If you can just hold your breath when I put the stethoscope on there. Okay, and then I'm going to palpate. Very good, I'll do the other side. Okay, so the pulse is equal and strong on both sides, and I did not hear any evidence of a brewery. So the next step is going to be your upper extremities. So I'm going to go ahead and inspect your skin. It is dry and cool to the touch as well as pink in color, so I'm going to go ahead and do your radial pulses. If you can just relax for me. Okay, pulses are equal and strong on both sides, so we're going to do range of motion exercises now. If you can just lift your arms to the side like you're trying to fly. Perfect. And then do a full circle. Okay, very good. And then we're going to do your abduction. So we're just going to move this up and down. And let's do the other side. There we go, up and down. Okay, very good. Now we'll do muscle strength. If you can hold your arms straight out in front of you. I'm going to push down while you try and keep them straight, okay? All right, go ahead and flex for me. Flex. Try and straighten your arms out. Okay, and now try and flex. Okay, very good. Patient is symmetrical on both sides. Her range of motion and muscle strength are equal. So now I'm going to move on to the chest and thoracic cavity. At this point, I'm going to be looking at the thoracic area, looking for any concaving, any asymmetries, any swelling or edema, and I do not see any of that. So we're going to go ahead and listen to your heart, okay?
Okay.
Go ahead and sit up straight for me. Perfect. Okay, and then at this time, I will take your heart rate by listening to your apical pulse for 1 minute. All right, your heart rate is 70, which is very good. Heart sounds are regular. I was able to hear both S1 and S2, no murmurs and no S3 or S4. So now I'm going to go ahead and listen to your lungs. When I ask you to take a breath, it's just a full inhale and exhale, okay?
Mm-hmm.
And take your time because there's a lot of spots, so I don't want you to get dizzy.
Okay.
Go ahead and sit up straight for me. All right, go ahead and take a deep breath. Okay, very good. Now I'm going to go to the back. Okay, very good. Sounds are tubular and they're bilateral and equal on both sides. And then the last thing we gotta do for thoracic is just check your anterior. So I'm just gonna pinch you right here. Okay, and that was his good skin turgor. It took less than 3 to 5 seconds to go back. So now I'm gonna do your abdomen. If you can go ahead and lay back for me. Okay, this time I'm going to inspect the abdomen, just fun sight. So I'm looking for any concaving, any obvious swelling, any abnormalities or asymmetry, but everything does look symmetrical. So the next step is to auscultate. I'm going to start in the right lower abdomen, and I'm looking for bowel sounds. Okay, so there are active bowel sounds, a little bit of hyperactivity, but you just might be a little bit hungry. So the next step is going to be to go ahead and percuss. And then palpate, looking for any swelling, any pain. If you feel any pain when I push down, just let me know, okay?
Okay.
Abdomen feels soft. There's no swelling, and patient doesn't have any pain during inspection and palpation. So the next step would be genitalia. At this time, I would go ahead and assess for the femoral artery, which is the inguinal area, and then I would assess the genitalia area, looking for anything like tubing if the patient's on an external catheter. I would look for any inflammation, any skin lesions, any abnormality in hair growth as well. And then we would move on to range of motion for the legs. So your lower extremities, I'm going to go ahead and inspect your skin. It is cool and dry, cool to the touch. So now I'm going to do your pulses. I'll start with the dorsalis pedis, which is on the top of the foot. Okay, pulses are equal on both sides, and now the posterior tibial. Okay, pulses are equal, and then I'll do the popliteal. I'm going to do one at a time. Okay, go ahead and lower. Okay, pulses are equal on both sides. If you can go ahead and lift your knee for me, straight up like this. Perfect, and then we can lay it down. Let's do the other side. And lay it down. Okay, range of motion is equal and intact on both sides. If you can go ahead and push against my hands. Okay, and now try and bend forward, perfect. Muscle strength is equal on both sides, and we'll just check the capillary refills. 3-second capillary refill, which is very good as well. If you can sit up for me. Okay, if you can just take a few steps that way and then come back. So I can assess the patient's gait. Okay, perfect, and stay standing for me. Go ahead and look at me. We're gonna do the Romberg test, so I just need you to have your feet together, hands by your side, and close your eyes. We're gonna stay like this for 20 seconds. I'm gonna try and push you a little bit, but try and keep your balance, okay?
Okay.
All right, very good. Patient has good balance. You can go ahead and take a seat.
Okay.
Do you have any questions or anything?
I do not, no.
Okay, wonderful. If you need anything, just go ahead and hit your call button, okay?
Okay, great, thank
So
you.
that completes the head to toe assessment. General inspection of the patient. His symmetrical from the head to the toe. Good, all cranial nerves are intact. No abnormal edema. And yeah.